If the amount of semen you ejaculate has been decreasing over time, it might be worrying you, and understandably. So semen volume is more than just a detail for many men. It's a symbol of vitality, and seeing it decrease can impact not only health, but also confidence. In this video, I'll help you understand the 6 most common causes of this reduction, from natural factors to things that can be adjusted. And most importantly, I'll share 5 practical tips to help you reverse this situation, with solutions that increase ejaculatory volume and restore your confidence in your sexual health. Before continuing, make sure you've subscribed to the channel to follow our videos on sexual health and relationships. Like the video to help us reach more people. Comment 1 if you're interested in the topic, or 0 if it wasn't relevant. So we can improve future videos. Many men worry about the amount of semen they release, but research shows that this concern is more important to them than to women. A European study found that 80% of women don't care about semen and volume during sex. Only 133% consider it relevant for men. A higher amount may seem like a sign of strength or performance, but for most women, this aspect doesn't affect the pleasure or connection they feel. What really matters in the relationship are other factors, not semen volume as years go by. It's common for men's bodies to produce less semen. This happens naturally as they age because the glands responsible for producing seminal fluid, such as the prostate and seminal vesicles, begin to function more slowly. Additionally, the body also produces less testosterone over time, further reducing semen quantity. This change is normal and usually noticeable from the age of 40 or 50, though it can vary from person to person. The first reason for decreased semen over time is the body's natural aging process. As men grow older, the body goes through various changes, one of which is a reduction in semen production. This occurs is because of glands that produce seminal fluid, like the prostate and seminal vesicles, start working at a slower pace. Additionally, testosterone, the hormone that helps regulate many male functions, also decreases with age. Thus, semen quantity can naturally reduce, and many men notice this change after 40 or 50 years. Though it doesn't happen the same way for everyone. To help you live a more fulfilling and satisfying sexual life, I'm offering the ebook Rediscovering Intimacy, Healthy Sexuality. After 60, this book offers practical and inspiring guidance to strengthen your relationship, overcoming emotional and physical challenges with effective strategies to rekindle passion and connection in marriage. To get your copy, click on the first pin. Comment "Don't waste time" as copies are limited. Take advantage of this opportunity to transform your love and emotional life. The second reason for reduced semen volume is something called retrograde ejaculation, instead of X sitting through the penis. As usual, the semen ends up in the bladder. This happens when the muscle that should prevent the semen from taking another path doesn't work correctly, allowing it to go in the wrong direction. This situation usually doesn't cause pain or serious health complications, but it can be frustrating for those who want to see a higher volume during ejaculation. Additionally, retrograde ejaculation can make fertility more difficult, since the semen doesn't reach its intended destination. This issue can be triggered by certain surgery, some medications, or health conditions like diabetes. The third reason for reduced semen volume is related to certain medications. Some medications, especially those prescribed for prostate problems like Testosterone and finasteride, can reduce the amount of semen released during ejaculation. These drugs help treat conditions such as benign prostatic hyperplasia by shrinking the prostate and easing urinary symptoms. However, as a side effect, they often reduce semen volume. Other types of medications, like those used in chemotherapy, antidepressants, and blood pressure medications, can also affect semen production or release. It's always important to talk to a doctor about side effects to understand the impact of each medication fully. The fourth factor that can reduce semen volume of surgery, especially those involving the prostate. A radical prostatectomy, for example, is a procedure where the prostate and seminal vesicles are removed, meaning the man will no longer ejaculate, though he may still feel orgasm in less invasive surgeries, such as prostate scraping. Something called retrograde ejaculation may occur where semen ends up in the bladder instead of exiting through the penis. These surgeries are often essential to treat serious problems like prostate cancer or urinary difficulties, but they directly impact the amount of semen expelled. The fifth factor that can reduce semen volume is diabetes. This condition can cause something called diabetic neuropathy, which is nerve damage in the body, including those that control ejaculation over time. Excess blood sugar can damage these nerves, making it harder to release semen from the penis, which can lead to incomplete ejaculation or even a total absence of semen. Additionally, diabetes can affect hormone production and the health of glands that produce semen, such as the prostate and seminal vesicles, for those living with diabetes. Maintaining controlled blood sugar levels is essential to reduce these impacts on sexual health. The sixth factor that can reduce semen volume of spinal cord injuries. The spinal cord works like a nerve, highway transmitting commands from the brain to different parts of the body, including the sexual organs. When this highway is damaged, the nerves that assist in ejaculation may be affected. This means that even if the body still produces semen, it may have difficulty releasing it during ejaculation. In more severe cases, a spinal cord injury can even completely prevent the ability to ejaculate. These types of injuries generally happen due to accidents or falls, and the effects vary from person to person, depending on the location and severity of the injury. Now that we've seen the main reasons for decreased semen volume, let's discuss what can be done to improve it. There are several ways to increase volume, many of which are easy to implement in daily life and bring overall health benefits. Next, I'll show you 5 practical tips that can help increase semen volume, promoting both a healthier sexual function and an overall sense of well-being. The first way to increase semen volume is to ensure proper hydration. Water is essential for the body to function well, including semen production. When the body is dehydrated, it produces fewer fluids, which reduce semen volume. So, drinking water regularly is crucial. A tip to check if you're hydrated is to observe in colour, which should be very light. Additionally, avoiding excessive alcohol is important, as it dehydrates the body and can reduce semen volume. The second tip to increase semen volume is to quit smoking. Smoking is harmful to the whole body, including semen production. The toxic substances and cigarettes damage the glands responsible for seminal fluid, such as the prostate and seminal vesicles. Moreover, smoking increases oxidative stress, causing inflammation and disrupting hormones essential for semen production. Another issue is that smoking affects circulation, compromising overall sexual health. By quitting smoking, the body has a chance to recover, and over time, semen and volume may increase. Adopting healthy habits instead of smoking brings many benefits and improves quality of life. The third tip to increase semen volume is to take a break from sexual activity for a few days. When a man ejaculates very frequently, whether in sexual relations or masturbation, the body has less time to produce and store semen, resulting in a lower amount at the next ejaculation. If he goes between 7 and 9 days without ejaculating, glands, like the prostate and seminal vesicles, can accumulate more fluid. This way, the volume tends to be higher. The next time, this simple pause allows the body to work at its own pace, ensuring a higher quantity of semen. The fourth tip to increase semen volume is to strengthen the pelvic floor muscles. And a simple way to do this is with Kegel exercises. These muscles help expel semen during ejaculation, and when they're stronger, they can do so more intensely, which may increase the volume released. To perform Kegel exercises, just contract the muscles you would use to stop urinating. Hold the contraction for a few seconds, and then release with constant practice. These muscles gain strength, bringing benefits both for semen and volume and general sexual health. These exercises are simple, can be done anywhere, and are beneficial for both men and women. The fifth tip to increase semen volume is to invest in supplements and, in some cases, appropriate hormone treatments. Sometimes semen quantity can be reduced due to a lack of certain nutrients or hormonal imbalances. For example, zinc is an important mineral for sperm production, and people with zinc deficiency may benefit from supplements. In some cases, men with low testosterone levels, such as an andropause or hypogonadism, may need hormone replacement therapy. Additionally, maintaining thyroid health is essential, as problems like hypothyroidism can also affect sexual function. Any supplementation or hormone treatment must be done under medical guidance to ensure safety and effectiveness. Now that we've covered the factors that can reduce semen volume and shared tips to enhance production, I'd love to know, which tip did you find most helpful? Leave your opinion in the comments, and if you know someone who might benefit from this information, share the video with friends and family. This helps to expand the reach of his content. Like the video, as every like makes a difference, supporting the channel to grow and bring more valuable content. And if you haven't subscribed yet, click the subscribe button and activate the bell to receive the next notifications. See you in the next video.